Hello everyone, I am Dr. Arti Gosavi, third year resident from Dr. Hidkewar Rugnalaya, Chhatrapati Sambhajinagar. I am presenting a paper on hidden defects exploring inner ear malformations. Introduction. Congenital sensory neural hearing loss is a significant health problem with a considerable impact on speech, language, and social development. Inner ear malformations represent the common cause of sensory neural hearing loss along with cochlear nerve abnormalities. Cochlear implantation has emerged as a highly effective treatment in appropriately selected patients. However, anatomical variations of the cochlea and inner ear are common and can directly affect the electrode placement, risk of cerebrospinal fluid gusher, and functional outcomes. HRCT of the temporal bone remains the cornerstone imaging modality for pre-surgical evaluation, classically for the inner and the middle ear malformations. It provides excellent delineation of the bony structures and allows classification of anomalies. MRI also helps in delineation of the cochlear and facial nerves, their anatomical variations or other abnormalities, which may further help deciding the prognosis post-implantation. The study was undertaken to analyze and classify inner ear malformations and their associations with other auditory canal anomalies, nerve abnormalities, and middle and external ear anomalies detected on the HRCT temporal bone in patients undergoing pre-surgical evaluation for cochlear implantation at our hospital. Methods. This is a hospital-based cross-sectional study conducted from July 2023 to July 2025 at a tertiary care center in Marathwada region of central India. Population: 256 patients referred to Radiology department for HRCT temporal bone for pre-surgical evaluation of the cochlear implantation. Inclusion criteria: patients with HRCT temporal bone for pre-surgical evaluation of the cochlear implantation. Exclusion criteria: incomplete imaging data, patients with history of previous cochlear implantation. Evaluation parameters: each scan was analyzed for inner ear morphology including bony and membranous labyrinth, middle ear, external ear, facial and cochlear nerves, and internal and external auditory canals. Inner ear anomalies were classified into categories according to Senna-Roglu classification. Data analysis: frequency and distribution of the anomalies were recorded and compared. Results: out of 256 patients who had undergone HRCT temporal bone for pre-surgical evaluation of the cochlear implantation, 51 patients had findings, either congenital or acquired abnormality. Out of 256 patients, 32 patients had congenital ear anomalies, 19 patients had serous otitis media, 7 patients had anatomical variation in the form of high-writing jugular bulb, and 198 scans were totally normal. Out of 32 patients with congenital ear anomalies, maximum were inner ear anomalies, which were 20 cases, that means 62.5%. Internal auditory canal anomalies were 5, that is 15%. Facial or cochlear nerve abnormality with normal cochlea were seen in 3 cases, and middle and external ear anomalies with normal cochlea were seen in 4 patients. Classification of inner ear malformations: out of 20 inner ear malformations, 7 cases showed dilated vestibular duct, 7 cases showed incomplete partition type 2. So these two contributed the maximum. Incomplete partition type 1 was present in 2 patients, and also complete labyrinthine aplesia was seen in 2 patients. Cochlear hypoplasia and incomplete partition type 3 were seen in 1 patient. Total inner ear malformations were 20, and among that, maximum were contributed by dilated vestibular duct and incomplete partition type 2. Out of all the inner ear malformations, 15 patients had bilateral involvement, that is 75 patients had bilateral involvement, and 5 patients had unilateral involvement. %70 of the patients were male and 30% of the patients were females. In 35% of the patients, modulus was dysplastic, and in 65% of the patients, modulus was normal. Associations of the inner ear malformations: out of 20 inner ear malformations, 20% cases were associated with internal auditory canal stenosis, 45% of the cases were associated with either absent or dysplastic semicircular canal, 15% patients had aberrant facial nerve, 5% patients had associated dysplastic 5% patients had associated absence of round window and oval window, and 10% of the cases had associated high riding jugular bulb. 5% of the patients had hypoplastic petrous bone. These are the images where we can see absent labyrinthine apparatus. So this was the case of complete labyrinthine aplasia. In figure 2, there is internal auditory canal stenosis. In figure 3, there are no cochlear turns, only single cystic structure was visible, so it was incomplete partition type 1. In figure 4, basal turn was normal and there were confluent middle and apical turns. So it was a case of incomplete partition type 2. And in figure 5, we can see bulbous internal auditory canal which was connected to basal turn of the cochlea. So this was a case of incomplete partition type 3. Discussion. In our study, overall incidence of inner ear malformation was 7.8%, which was comparable to previously reported prevalence rates in patients undergoing imaging for congenital hearing loss. The predominance of inner ear anomalies, which was 62.5% out of the positive patients, reinforces the embryological vulnerability to the otic capsule during early gestation. The most frequent anomalies identified were dilated vestibular duct and incomplete partition type 2, each accounting for 35% of the cases. The findings are consistent with earlier literature, which cites enlarged vestibular aqueduct as one of the most common radiological abnormalities in children with congenital sensory neural hearing loss. Incomplete partition type 2 has also been widely reported as the most frequent cochlear anomaly. Modular abnormalities were observed in 35% cases of the inner ear malformations, predominantly in those with incomplete partition, while the remaining variants showed no modular involvement. Bilateral involvement was seen in 75% of the cases, suggesting that these anomalies are more commonly seen bilaterally than unilaterally. Additionally, higher prevalence in male patients suggests a possible gender predilection. Our study also highlighted several associated abnormalities in patients with inner ear malformations. Dysplastic semicircular canals were the most common coexisting anomalies. In our study, males accounted for 70% of the patients. However, the differences were not that statistically significant. Thus, while males appeared more frequently among affected patients, this likely reflects sampling variation rather than a true biological gender predilection. The study is limited by its sample size and lack of correlation with post-operative surgical and audiological outcomes, which would add value to the analysis. Further prospective studies with larger cohorts and follow-up data are warranted. Thank you.